I was asked to talk about Parkinson's disease and Parkinsonism, but because the physician before me already gave you a little bit about Parkinson's disease, I'm not going to touch too much on that, and I'm just going to talk about Parkinsonisms, or atypical Parkinson's, or sometimes your doctor looks at you and says, I don't know what you have. So that's this basket, okay? Basically, Parkinsonism means it looks like Parkinson's disease. Maybe there's a tremor, maybe there's a shuffling gait or a shuffling to the walk, maybe there's stiffness or rigidity, falls or imbalance. Maybe there's only one of these, maybe there's a couple of these, but it looks like Parkinson's disease. How is a movement disorder like a bird watcher? Well, if you're like me and don't know anything about birds, all 5 of these birds are just bluebirds, okay? They're all blue, they're all little, they're birds. But there's several people out there, I'm sure, who'll recognize that no, there's only one bluebird in that picture. Then there's a blue jay, and there's a parrot, and there's a who knows what, right? So the purpose of that slide is to ask you to please don't self-diagnose yourself. You will have many things in common with what I talk about next, the other Parkinson syndromes. Identifying and diagnosing those different Parkinsonisms takes an expert and actually years of following the patient, not just a checklist. Just because you're blue doesn't make you a blue jay, okay? And again, let me emphasize, what I'll say, you'll nod your head, you'll go, that's me, that's me, that's me. Be real careful, because unless a doctor diagnosed you with one of these things, it may not be you, okay? So what can look like Parkinson's disease? On the left there is obviously Parkinson's disease, imagine that. And then there's atypical Parkinson's disease. On the right are lots of other things, strokes, head injuries, normal pressure, hydrocephalus, and the list goes on and on of other things that can look Parkinsonian. I'm not going to go on that because that would take about 3 days to go through, but we're just going to go over the atypical Parkinson's diseases. What difference does it make? If it's blue, who cares if it's a parrot versus a blue jay? It's just a bluebird, right? It actually makes a lot of difference. Prognosis might be quite different. What you'll be dealing with over the next few years may be very different from someone else who's dealing with a different disease. And the treatment might be very different. So it is important to understand or to be diagnosed appropriately when that diagnosis becomes clear. This is actually a much more complicated situation or group of disorders than this slide will pretend to be. But to make things as simple as possible, I group these into 4 symptom onsets. So if your earliest symptom was memory loss, you might be diagnosed later with Lewy body dementia. If your earliest symptom before anything else showed up was falling, you might later be diagnosed as PSP or CBD. If your earliest symptom was maybe a behavioral change, you might be diagnosed with FTD or frontotemporal dementia. And if the earliest thing was fainting, maybe it's something else called multiple system atrophy. I'm going to talk about each one of these, and because these words are huge and hard to keep saying, especially when you're nervous and standing in front of 300 people, I'm just going to use the acronyms there. So Lewy body dementia is LBD, progressive supranuclear palsy and corticobasal degeneration are PSP and CBD, frontotemporal dementia is FTD, and multiple system atrophy is MSA. The other thing I'm going to use as we go forward are cartoon characters. to try and give you kind of an image, and so I can put a story with it. I don't mean to use cartoon characters as mocking anything or make light of it, because they're all very serious diseases.